Tell me about your experience as a clinical nurse specialist.
As a clinical nurse specialist, my experience has been centered on three key areas: clinical expertise, education, and leadership. In my previous role at a large metropolitan hospital, I specialized in critical care, focusing on improving patient outcomes for those with complex respiratory conditions. My day-to-day responsibilities involved acting as a clinical resource for the nursing staff. I would conduct bedside rounds, providing expert consultation on patient care plans and troubleshooting complex cases. For example, I developed and implemented a new protocol for ventilator weaning, which resulted in a significant reduction in the average time patients spent on mechanical ventilation. Beyond direct patient care, a major part of my role was staff education and mentorship. I created and delivered a series of workshops on advanced hemodynamic monitoring and sepsis recognition, which equipped our nurses with the knowledge and confidence to make quicker, more informed decisions. I also mentored new nurses, guiding them through difficult cases and helping them transition into a high-acuity environment. This focus on staff development was crucial to improving the overall quality of care on our unit. In terms of leadership, I spearheaded several quality improvement initiatives. I collaborated with an interdisciplinary team to reduce catheter-associated urinary tract infections (CAUTIs). By analyzing data, identifying gaps in practice, and implementing new evidence-based guidelines, we achieved a 40% reduction in CAUTI rates within 1 year. This experience taught me the importance of data-driven decision-making and collaborative problem-solving. My time as a CNS has been incredibly rewarding, allowing me to influence patient care not only at the bedside but also at a systemic level through education and quality improvement. I am confident that these skills and experiences align well with the responsibilities of a clinical nurse specialist here.
Why do you want to work for our healthcare organization?
I'm very keen to work for your healthcare organization because of its stellar reputation for patient care and its commitment to professional development. I've been following your work for some time, particularly your initiatives in community outreach and your focus on evidence-based practice, which aligns perfectly with my own nursing philosophy. Your recent article in the Journal of Clinical Nursing on reducing readmission rates for heart failure patients, for example, really impressed me with its innovative approach. I'm looking for a place where I can grow as a nurse and contribute to a team that is dedicated to excellence, and everything I've learned about your hospital tells me this is that place. I'm also drawn to the collaborative environment here. I believe the best patient outcomes are achieved through strong teamwork and clear communication across disciplines. During my research, I saw that your organization places a strong emphasis on interdisciplinary collaboration and invests in resources that support it. This kind of environment would allow me to apply my skills in a way that truly benefits both patients and my colleagues. I want to be part of a team that constantly pushes for better ways to deliver care, and your organization's commitment to quality improvement and staff education is exactly what I'm looking for in my next role. I'm confident that my experience and passion for nursing would make me a valuable asset to your team and help you continue to achieve your goals.
How do you stay current with the latest clinical research and best practices in your specialty?
Staying current with the latest clinical research and best practices is a continuous and essential part of my professional life as a nurse. I use a multifaceted approach to ensure my knowledge remains up-to-date and evidence-based. First and foremost, I make it a priority to regularly read reputable medical journals and publications in my specialty, such as the New England Journal of Medicine and the Journal of Clinical Nursing. I subscribe to several peer-reviewed journals and newsletters that send me weekly updates on new research findings, which helps me stay on top of the most recent developments. This allows me to not only be aware of new protocols, but also to critically evaluate the evidence behind them. In addition to reading, I am a firm believer in the value of professional development through seminars and workshops. I attend at least 2 major conferences each year, which provides an excellent opportunity to learn from leading experts and network with other professionals. I also recently completed a certification course in advanced wound care, which gave me in-depth knowledge of the latest techniques and dressings. I also actively participate in my hospital's journal club, where we meet to discuss and debate new research papers. This collaborative environment challenges my assumptions and deepens my understanding of complex topics. By combining personal study with professional development and peer collaboration, I ensure that my practice is always grounded in the most current and effective methods available, directly benefiting the quality of care I provide to my patients.
Describe a time when you had to lead a change in clinical practice. What was the outcome?
A clear example of a time I led a change in clinical practice was during my previous role, where I noticed a significant issue with inconsistent pain management for our post-operative patients. The existing protocol was quite general and didn't account for individual patient needs or the specific type of surgery. This led to a cycle of patients experiencing uncontrolled pain, which not only affected their comfort but also delayed their recovery and discharge. I felt strongly that we could do better. To address this, I initiated a quality improvement project. My first step was to collaborate with our nurse educators, surgeons, and pharmacists to review current evidence-based guidelines on post-operative pain management. We identified that a more personalized, multimodal approach was needed, one that incorporated both pharmacological and non-pharmacological interventions. I then developed a new, more comprehensive pain management protocol that included a standardized pain assessment tool, scheduled around-the-clock medication, and patient education on using relaxation and distraction techniques. I presented this new protocol to the nursing staff in a series of in-service sessions, providing hands-on training and answering any questions they had. The outcome was incredibly positive. Within 3 months of implementing the new protocol, we saw a noticeable improvement in our pain scores. Patients reported a higher level of satisfaction with their pain control, and we observed a decrease in the use of as-needed PRN opioid medications, which was a key goal. The most rewarding outcome, however, was seeing the nurses feel more confident and empowered in their ability to manage patient pain effectively. The project not only improved patient well-being but also fostered a more collaborative and evidence-driven culture in our unit, proving that a small change can lead to a significant impact.
What is your philosophy on patient-centered care, and how do you implement it in your role?
My philosophy on patient-centered care is that it's a holistic approach that places the patient and their family at the very core of every decision. It goes beyond simply treating a medical condition. It's about seeing the patient as a whole person with unique values, preferences, and a life outside of the hospital. I believe it is our professional duty to respect their autonomy and actively involve them in their care plan. This creates a partnership built on trust and mutual respect, which ultimately leads to better health outcomes and a more positive patient experience. I implement this philosophy daily by first and foremost, by making time to truly listen to my patients. I don't just ask about their symptoms, I ask about their concerns, their fears, and their goals. For example, in my previous role in cardiac care, a patient recovering from a heart attack was anxious about returning home. Instead of just giving him standard discharge instructions, I spent time understanding his concerns about managing his diet and exercise routine. We then worked together to create a realistic plan that fit his lifestyle, which included specific, simple meal ideas and a walking schedule he felt confident he could maintain. Another key aspect is ensuring clear and constant communication. I make a point to explain every procedure and medication in a way that is easy for the patient to understand, avoiding medical jargon whenever possible. I also make sure the patient's family is included in conversations, as they are a vital part of the support system. By ensuring they have all the information they need, I empower them to be active participants in the healing process. This collaborative approach not only improves patient satisfaction, but also fosters a sense of shared responsibility for their health, leading to better long-term compliance and recovery.
A nurse is struggling with a complex patient case. How do you approach this to support them and improve patient outcomes?
When I encounter a nurse who is struggling with a complex patient case, my first step is always to approach them with empathy and a collaborative spirit. I begin by asking them to walk me through the situation in detail, listening carefully to their concerns and understanding their perspective. It's crucial to create a safe space where they feel comfortable expressing their difficulties without fear of judgment. This initial conversation is key to accurately assessing the problem and identifying what kind of support is needed. It could be a gap in their knowledge, a struggle with a specific skill, or a more systemic issue related to the patient's care plan. Once I have a clear understanding, I would move from a listening role to a supportive one. I would offer to work alongside them, not just telling them what to do, but guiding them through the process. For example, if the complexity lies in managing multiple 4 drips for a critically ill patient, I would first review the medications with them, explaining the purpose of each one and how they interact. Then, I would supervise them as they perform the task, providing real-time feedback and corrections. My goal is to empower them with the knowledge and confidence to handle similar situations in the future. Ultimately, my approach is designed to improve both the immediate patient outcome and the long-term professional development of the nurse. By providing immediate support at the bedside and following up with educational resources or a debriefing session later, I ensure the patient receives the best possible care while the nurse gains a valuable learning experience. This method fosters a culture of continuous learning and mutual support, which is essential for maintaining high standards of care across the unit.
Describe a time you encountered a significant patient safety issue. What steps did you take?
One time, I encountered a significant patient safety issue when I was caring for a patient who had recently undergone hip surgery. During my evening rounds, I noticed that the patient's SCD sequential compression device was not properly positioned on one of their legs. The device was supposed to prevent deep vein thrombosis, DVT, a serious and potentially fatal complication. The tubing was tangled, and the sleeve was bunched up, rendering the device ineffective. This was a significant safety risk as the patient was immobile and at high risk for a DVT. I immediately recognized the potential for harm and took a series of steps to address it. First, I paused and took a deep breath to remain calm and focused. My immediate priority was the patient's safety, so I carefully untangled the tubing and repositioned the SCD sleeve to ensure it was functioning correctly and providing the necessary compression. As I was doing this, I explained to the patient what the device was for and why it was so important that it remained properly positioned, which also served as a teaching moment. After ensuring the patient was safe, I then took steps to address the systemic issue. I documented the incident thoroughly in the patient's chart, detailing my findings and the corrective actions I took. Following that, I spoke with a nurse from the previous shift. I approached her with a non-judgmental attitude and simply explained what I had found. We discussed the importance of double-checking all equipment during patient handovers and a plan for more rigorous checks in the future. I also brought the issue to the attention of our nurse manager during our safety huddle, suggesting we conduct a brief in-service training on the proper use and common errors with SCDs. This incident reinforced my commitment to vigilance and proactive communication, showing that addressing a safety issue isn't just about fixing the immediate problem, but also about preventing it from happening again.
How do you use data and quality metrics to influence practice changes?
I consistently use data and quality metrics to influence practice changes by first identifying a problem, then gathering and analyzing relevant data, and finally using that data to build a compelling case for improvement. For instance, in my last role, our unit was experiencing a higher than average rate of hospital-acquired pressure ulcers. This was a significant patient safety concern and a clear target for a quality improvement project. My initial step was to pull the unit's data from our electronic health record system to pinpoint when and where these ulcers were most frequently occurring. I looked at various metrics, including patient length of stay, mobility status, and the timing of nursing interventions like repositioning. The data revealed a pattern. A high percentage of ulcers were developing on weekends, often in patients with limited mobility. This suggested a gap in consistent care during peak weekend staffing. Armed with this information, I didn't just point out the problem. I used the data to propose a specific, evidence-based solution. I created a simple, visual pressure ulcer prevention dashboard that nurses could use during their shift huddles to identify high-risk patients. I then educated the staff on a new, more frequent repositioning schedule for these patients. The dashboard made the data actionable and easy for everyone to understand. The outcome was very positive. Within 6 months, our pressure ulcer rate dropped by over 60%, and the consistent use of the dashboard became a permanent part of our unit's workflow. This experience showed me that data isn't just for reporting. It's a powerful tool for driving meaningful, positive change in patient care.
Walk me through a time when you had to manage a conflict between a nurse and a physician regarding a patient's care plan.
Navigating conflict is an important part of my role, and I've had to mediate disagreements between nurses and physicians on several occasions. A clear example occurred when a new physician wrote an order for a patient to be discharged, but the primary nurse on the case felt it was premature. The patient had a complex wound that the nurse believed required further in-hospital observation and care. The physician, however, felt the patient was stable and could be managed at home by a community nurse. The tension was palpable, and the nurse was frustrated because she felt her clinical judgment was being ignored. My first step was to pull the nurse aside privately to listen to her concerns. I allowed her to articulate her reasoning fully, focusing on the specific clinical indicators that made her believe discharge was unsafe, such as the wound's appearance and the patient's poor pain control. After gaining a clear understanding of her perspective, I approached the physician. I presented the nurse's concerns using objective, clinical language, highlighting the specific data points, such as the amount and type of wound drainage, that had led to her assessment. My goal was to facilitate a professional dialogue, not to take sides. I framed a discussion as a collaborative effort to ensure the best patient outcome, rather than a conflict. This approach was successful. The physician acknowledged the nurse's detailed observations and agreed that an in-person reassessment was warranted. They went together to examine the patient and ultimately decided to delay the discharge by 1 day to allow for further wound care and to ensure the patient was fully stable. By acting as a neutral intermediary and focusing on objective clinical information, I was able to de-escalate the situation and ensure the patient's safety was the top priority. This experience taught me that effective communication and a commitment to evidence-based practice can resolve even the most difficult interprofessional conflicts.
How would you mentor a new nurse or a nurse who is transitioning to a new specialty?
Mentoring a new nurse or one transitioning to a new specialty is a process that I approach with a structured, yet flexible mindset. My primary goal is to empower them by building their confidence and competence, ensuring they feel supported every step of the way. I would begin by establishing a foundation of trust and open communication. It's crucial for them to know they can ask any question without fear of judgment. I'd start with a thorough orientation to the unit, focusing on key protocols, equipment, and patient populations. This initial phase would be about building a strong knowledge base. Once they've grasped the fundamentals, I would move into a more hands-on observational phase. I would ask them to walk me through their thought process for a patient's care, allowing me to identify any knowledge gaps or areas where they need more support. Instead of simply providing answers, I would use probing questions to guide them toward the correct decisions. For instance, if they were unsure about a medication's side effects, I would ask, "What resources can you use to find that information?" This approach encourages them to become independent and resourceful problem solvers. As they gain more confidence, I would gradually increase their autonomy while remaining a constant presence for support. I would continue to provide constructive feedback, always highlighting their strengths first before discussing areas for improvement. My mentoring style is not just about teaching clinical skills. It's about helping them develop critical thinking, resilience, and professional confidence. I believe this kind of mentorship is essential for creating a safe and competent nursing workforce, and I am confident that my approach would help any new nurse not only succeed but thrive in their new role.
What is your approach to educating staff on new protocols or evidence-based practices?
My approach to educating staff on new protocols or evidence-based practices is to make the information accessible, relevant, and engaging. I found that simply distributing a new policy document isn't effective. Instead, I believe in a multi-pronged strategy that caters to different learning styles. First, I always begin with a brief but comprehensive presentation that outlines the why behind the change. I explain the evidence-based rationale and the expected patient outcomes. For example, when introducing a new protocol for central line-associated bloodstream infection, CLABSI prevention, I would start by showing data on our current infection rates and then present the research that supports the new guidelines. This helps staff understand the importance and value of the change, increasing their buy-in from the start. Next, I follow up with hands-on practical training. I find that nurses learn best by doing. I would set up a skills station where they can practice the new procedure in a safe, low-pressure environment. I make sure to be available to answer questions and provide immediate, constructive feedback. I also create and distribute easy-to-read job aids or quick reference guides that can be kept on the unit for future use. Finally, I reinforce the new practice with ongoing support. This includes regular check-ins, informal huddles, and continued mentorship. I believe that education is not a one-time event. It's a continuous process. By offering this sustained support, I can ensure that the new protocol becomes a consistent part of daily practice, ultimately leading to improved patient safety and better overall care.
Describe your experience in interdisciplinary collaboration. How do you ensure all team members are on the same page?
Interdisciplinary collaboration is a cornerstone of my nursing practice. My experience has shown me that no single healthcare professional holds all the answers, and the best patient outcomes are achieved when we all work together seamlessly. I have extensive experience collaborating with physicians, physical therapists, pharmacists, social workers, and case managers. For example, during my time on a medical surgical unit, I was a key member of the daily rounds team. We would meet to discuss each patient's care plan, progress, and discharge needs. My role was to provide the nursing perspective, sharing critical information about the patient's mobility, pain levels, and readiness for discharge. To ensure all team members are on the same page, I rely heavily on clear, concise communication and active listening. I make it a point to go into every huddle or meeting with a clear understanding of my patient's status and my own questions and concerns. When speaking, I use SBAR, situation, background, assessment, recommendation, to provide a structured and efficient report. I also believe in creating a culture of mutual respect. I actively listen to the opinions and expertise of my colleagues from other disciplines and ask questions when something isn't clear. For instance, if a physical therapist suggested a certain type of exercise, I would ask them to explain the rationale so I could reinforce it with the patient during my rounds. By fostering this open communication and shared understanding, we ensure that everyone is working toward a unified goal. This collaborative approach not only prevents errors and avoids miscommunication, but also helps us provide truly holistic care that addresses all aspects of a patient's health and well-being. It is a fundamental part of my approach to nursing leadership and a skill I am confident in bringing to your organization.
How do you handle resistance to change from staff or other departments?
Resistance to change from staff or other departments is a common challenge, and my approach is to handle it proactively and collaboratively. I've learned that resistance is often rooted in fear of the unknown, a lack of understanding, or concern that the change will create more work without clear benefits. My first step is to never dismiss their concerns. Instead, I make a point to listen actively and validate their feelings. I'll schedule a time to talk with the individuals or the department to truly understand their specific objections and what's driving their resistance. This shows respect for their experience and expertise. Once I have a clear understanding, I can then tailor my communication to address their specific concerns. For example, when implementing a new electronic health record HR system, a lot of the older, more experienced nurses were resistant, worried it would slow down their workflow. Instead of just telling them it was mandatory, I showed them how the new system could actually save them time on charting and provide more accurate patient data. I offered one-on-one training sessions and made myself available for support during the transition. I also made sure to highlight early successes and positive feedback from other team members who embraced the change. By involving the staff in the process and making them part of the solution rather than just telling them what to do, I find that resistance can often be transformed into collaboration. It's about building trust and demonstrating that the change is a shared goal, not just a top-down mandate. My experience has shown that this empathetic and transparent approach not only smooths the transition, but also fosters a more resilient and adaptable team.
In your opinion, what is the most challenging aspect of the CNS role?
In my opinion, the most challenging aspect of the clinical nurse specialist (CNS) role is navigating the complex dynamics of influence without formal authority. Unlike a nurse manager, a CNS doesn't have direct power over staff or other departments. Our ability to affect change and improve patient outcomes relies entirely on our clinical credibility, communication skills, and ability to build relationships. You have to be a skilled influencer, persuading colleagues to adopt a new practice because they trust your judgment and see the evidence, not because you told them to. This can be particularly tough when you're trying to change deeply ingrained habits or traditions within a team. Another significant challenge is managing the sheer breadth of the role. A CNS is expected to be a clinical expert, educator, researcher, and leader all at once. This means you are constantly shifting gears throughout the day, from providing expert consultation at a patient's bedside to analyzing quality improvement data, and then teaching a new protocol to a group of nurses. The ability to prioritize and balance these competing demands effectively is a constant challenge. It requires a high level of self-discipline and strategic thinking to ensure all aspects of the role are addressed without compromising on quality. It's a role that demands both deep clinical knowledge and exceptional interpersonal skills to be successful.
How do you measure the success of a quality improvement project you have led?
I measure the success of a quality improvement QI project by using a combination of both quantitative and qualitative metrics. Simply looking at numbers isn't enough. You also need to understand the human impact of the change. My approach begins with establishing clear baseline data before the project even starts. For example, in a project to reduce hospital-acquired pressure ulcers, I would first collect data on the number of new ulcers that developed on our unit over a specific period, say 3 to 6 months. This gives me a solid starting point to measure against. Once the new intervention is implemented, I would continue to collect this data at regular intervals to track the change over time. For a recent QI project focused on improving patient pain management, the quantitative metrics were clear: a reduction in patient-reported pain scores and a decrease in the use of as-needed pain medication. We tracked these numbers diligently, and they showed a significant improvement. However, the qualitative success was equally important. I measured this by talking to both patients and nurses. I asked patients if they felt their pain was better controlled and if they felt more involved in their care plan. I also held informal discussions with the nursing staff to gauge their feedback. They told me they felt more confident and empowered with the new protocols, which not only improved patient outcomes but also boosted staff morale and job satisfaction. The true success of any QI project, in my opinion, is not just achieving a specific number, but creating a positive, lasting change in practice that improves patient care and makes the process more efficient for the healthcare team. When a project becomes a permanent, seamless part of our workflow, and everyone involved feels a sense of ownership, that's how I know it has been a success.
How do you manage your time and prioritize multiple projects and responsibilities?
I manage my time and prioritize multiple projects by using a structured approach that ensures I'm both efficient and effective. I start each shift by creating a prioritized to-do list based on patient acuity and urgency, using a framework like the ABCs: airway, breathing, circulation, and Maslow's hierarchy of needs. This allows me to address the most critical patient needs first while ensuring routine tasks are completed in a timely manner. I also make a habit of grouping similar tasks together, for instance, preparing all my medications for a specific time window at once to reduce wasted trips. For more long-term projects, like a quality improvement initiative or a staff education program, I break the project down into smaller, manageable steps with clear deadlines. I use a digital calendar or a simple project management tool to track my progress and keep me on schedule. This prevents me from feeling overwhelmed and ensures that I'm consistently moving the project forward, even during busy weeks. I also believe that effective delegation is a key part of time management. If a task can be safely and appropriately delegated to a colleague, like a licensed practical nurse or a certified nursing assistant, I will do so to free up my time for more complex clinical duties. I make sure to provide clear instructions and follow up to ensure the task is completed correctly. Ultimately, my time management is guided by a focus on patient safety and the most critical needs of the unit, but I also make sure to set aside time for proactive, long-term projects that contribute to the overall quality of care. It's a balance of reacting to immediate needs and planning for future improvements.
What is your greatest professional accomplishment as a CNS?
My greatest professional accomplishment as a clinical nurse specialist was leading a project to significantly reduce the rate of patient falls on our unit. When I first identified this as a problem, our fall rate was consistently above the national benchmark, which was a serious safety concern and a source of great stress for both patients and staff. I decided to take a proactive, evidence-based approach to address it. I began by forming a multidisciplinary task force that included nurses, physical therapists, and nurse aides. Together, we conducted a comprehensive review of all fall incidents over a 6-month period, analyzing the data to pinpoint the most common causes and times of day when falls occurred. The data revealed a clear pattern. A high number of falls were happening during shift changes and at night. Armed with this insight, I developed and implemented a new fall prevention protocol. The protocol included more frequent rounding, a standardized fall risk assessment tool, and a visual alert system that identified high-risk patients at a glance. I was responsible for educating the entire nursing staff on the new protocol, providing hands-on training and answering any questions. We also began holding brief huddles at the beginning of each shift to highlight high-risk patients and ensure everyone was aware of the new plan. The outcome was remarkable. Within 1 year, our unit's fall rate decreased by over 50%, bringing us well below the national average. This accomplishment was particularly meaningful to me because it wasn't just about a number. It was about creating a safer environment for our patients and giving the nursing staff the tools and confidence to prevent a common yet serious patient safety issue.
Where do you see yourself in 5 years?
In 5 years, I see myself as a seasoned and highly respected clinical nurse specialist within a leading healthcare organization, ideally in a role like the one I'm interviewing for today. I don't just want to continue doing what I'm doing, I want to evolve my practice and take on greater responsibility. I see myself having successfully led several significant quality improvement projects that have measurably improved patient outcomes and streamlined nursing processes. For instance, I hope to have developed and implemented a unit-wide protocol for a common clinical challenge, similar to my work with fall prevention. I also want to have further honed my skills as a mentor, becoming a go-to resource for both new and experienced nurses, helping them navigate complex cases and advance their own careers. I also envision myself contributing to the nursing profession on a broader scale. I plan to pursue additional certifications in my specialty and continue publishing my research and findings in peer-reviewed journals. This would allow me to share my expertise and contribute to the body of nursing knowledge beyond the walls of this hospital. My goal is to be seen not just as a skilled clinician, but as a thought leader and a champion for evidence-based practice. I want to be an integral part of this team's success, helping to shape the future of nursing care and solidify this organization's reputation for excellence.
Describe a time when you received constructive feedback. How did you respond to it?
I recall a time early in my career when I received constructive feedback from a senior nurse regarding my time management and patient flow. I was handling a particularly busy shift on a medical surgical floor, and a patient's family member expressed frustration about a delay in their loved one's care. The senior nurse later pulled me aside and gently pointed out that while my care was thorough, I was spending too much time on each patient, which was impacting my ability to manage the overall needs of the unit. The feedback was direct, but delivered with a clear intention of helping me grow. My immediate response was to listen without becoming defensive. I asked for specific examples and clarification on what she meant by time management. She explained that I could be more efficient by grouping tasks, such as administering medications to all my patients at once rather than doing one patient at a time. She also suggested using my shift report time to create a more strategic plan for the upcoming hours. I thanked her for her honesty and valuable insight. I didn't see her feedback as criticism, but as a gift, an opportunity to improve. Following that conversation, I made a conscious effort to apply her suggestions. I started to map out my shift more deliberately, prioritizing tasks and grouping them more efficiently. I also began to proactively seek out quick 5-minute check-ins with her throughout my shift to get a perspective on my progress. This practice not only made me more efficient, but also significantly improved my confidence and reduced my stress levels. The experience taught me that constructive feedback is essential for professional growth, and that approaching it with an open mind and a willingness to learn is the only way to truly benefit from it. What is your biggest weakness, and what are you doing to address it? My biggest weakness is that I sometimes struggle with a tendency to take on too much responsibility, which can make it challenging to delegate tasks effectively. I've always had a strong sense of personal ownership over my work and patient care, and in the past, this has led me to try and do everything myself, even when I had capable colleagues who could have helped. I recognize that this was not only inefficient, but also a missed opportunity to empower my teammates and foster a more collaborative environment. To address this, I've been actively working on improving my delegation skills. I made a conscious effort to identify tasks that can be safely and appropriately delegated, particularly to junior nurses or nurse aides. When I delegate a task, I now take the time to provide clear, specific instructions and explain the rationale behind the task. For example, instead of just asking a colleague to reposition a patient, I'll explain why it's important for skin integrity and show them the proper technique. I also make sure to check back and provide positive reinforcement once the task is complete. I also continue to work on my time management. I use a daily prioritization system that helps me visually see when I'm overbooked, which serves as a prompt to consider where I can delegate. This practice has not only improved my own efficiency, but has also built a stronger sense of teamwork on my unit. I've learned that effective leadership isn't about doing everything yourself, but about leveraging the skills of the entire team to achieve the best possible outcomes for our patients.